Next up we have Renae Fomiatti, also from La Trobe University, from Arches, and Renae will be speaking on post-crisis entanglements in the time of direct-acting antiretroviral treatment for hepatitis C. Thanks, Renae.
Is my screen, I'm a bit scared of presenting online.
It looks terrific, it's perfect.
It's all good and you can hear me?
Yes, we can.
Okay, good. I'm just going to get rid of myself. So I'm Renae Fomiatti and I'm a research officer at Arches. And I'd also like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, waters and culture, and pay my respects to elders past and present. I'd also just like to apologise for being the third person in a row to use La Trobe's red slides. We didn't realise it would be the case, but I apologise for all of those watching that we don't have more interesting and dynamic slides for you all, but that's just how it is. So the data that this presentation is based on is from the same ARC Discovery project on experiences of treatment for hepatitis C that Adrian mentioned. So I won't go through the acknowledgements again, but I would like to acknowledge Adrian, who has worked on this article on which the presentation is based and helped develop many of the ideas in it. So until the recent introduction of the new direct-acting antiviral medications, there was no cure for hepatitis C. The only treatments available were extremely lengthy and onerous interferon-based therapies with a relatively weak success rate. And interferon was delivered via injections and treatment often lasted 6 to 12 months. And the experiences of these medications have been well documented with side effects including flu-like symptoms, fatigue, fever, trouble sleeping, nausea, vomiting, diarrhea, and mental health difficulties such as depression and anxiety. So the new DAA medications introduced in 2016 in Australia have been lauded, as Adrian mentioned, as a treatment revolution by some. They're taken orally, treatment lasts around 3 months, and they have far fewer side effects and superior cure rates of around 95%. So as a result, there's been much enthusiasm and optimism in social marketing, health promotion activities and research that we are in a new era of treatment. And some research suggests that along with significant changes in prescribing and availability, the new medications have had a revolutionary impact and transformed the clinical management of hepatitis C. Optimism and hope surrounds the relative ease of the new medications, the miracle of cure and a much longed for future without hepatitis C. However, it has been suggested that ongoing concerns about side effects and negative experiences with the older interferon-based treatments continue to be impediments to the uptake of the new medications. So in this presentation today, I'm going to draw on queer theory on time and futurity to explore this tension of how the experiences of the old treatments shape contemporary treatment experiences, but beyond the usual focus on reputation and side effects. So briefly, as Adrian noted in the previous presentation, social research has complicated biomedical accounts of cure and elimination by demonstrating that biomedical cure does not always meet the expectations or needs of some people accessing treatment. And I think Martin mentioned this in the comments on the previous presentation as well. And so researchers have started to engage with the temporal dimensions of the new treatments and cure and have explored how futures of hepatitis C elimination and hepatitis C are brought into being through contemporary knowledge practices. And so it's within this growing literature that resists taken for granted assumptions about the simplicity of curative futures that this presentation contributes. So for today, I'm going to be bringing the concept of post-crisis developed by Dion Kagan, who I think is here in the audience, in critical scholarship on HIV and AIDS, into dialogue with recent theorisations of queer temporalities by queer and crip scholar Alison Kafer. I'd also like to nod to some of the people who are in the audience who are in this Kafer reading group. They've very much helped me understand her book, and it's been very helpful to be a part of this year. So evolving from the concept of post-AIDS, coined by sexuality scholar Gary Dowsett at a health promotion conference in 1995, post-crisis, says Kagan, captures the period of time and evolving conditions of the epidemic after the advent of antiretroviral drugs. So the introduction of these new medications in 1996 ostensibly transformed HIV and AIDS from a death sentence into a chronic but manageable illness. As Kagan argues, post-crisis is a periodising framework, but one that also, and I quote, describes the cultural rescripting of HIV/AIDS from a state of crisis to one of chronicity but has acted as a backdrop to new representations of HIV and AIDS and male homosexuality. So in this regard, post-crisis describes not only a temporal distinction, but a category of culture and representation. And like other post concepts, post-crisis is not a neatly demarcated temporal schema, but instead captures continuities and changes in the meanings, representations and practices of HIV and gay men's sexual lives. So for the purpose of this presentation, I'm using the term crisis, not in relation to hepatitis C or even the experience of the virus itself, which for many is a slow developing disease with minimal symptoms, but to refer to the crisis wrought by the older interferon-based treatments. And I ask, how does this crisis in hepatitis C treatment manifest in this purportedly new era? And so to think through these relations of change and continuity in post-crisis, I also draw on Alison Kafer's work on curative futures. So in her book, Feminist Queer Crip, Kafer explores how time, temporality and futurity have been framed in curative terms in contemporary understandings of disability. Disability, she argues, is always already understood through curative time that works in the service of a singular future of able-bodiedness and able-mindedness. She writes, and I quote, "I am speaking here about a curative imaginary, an understanding of disability that not only expects and assumes intervention, but also cannot imagine or comprehend anything other than intervention. Futurity has often been framed in curative terms, a time frame that casts disabled people as out of time or as obstacles to the arc of progress. And within this frame of curative time then, the only appropriate disabled mind, body is one cured or moving towards cure." So for the purpose of this presentation, I explore the features and effects of this curative imaginary in experiences of the new hepatitis C treatment. I argue that there are important limitations, deferrals and continuities that require consideration in the post-crisis treatment landscape that complicate claims about this new era that we're apparently in. Again, Adrian just spoke about the project, so I won't rehash the method here, except to remind you that we interviewed 50 people affected by hepatitis C living in Victoria and New South Wales, and who had various experiences of hepatitis C diagnosis, treatment, cure, and life following treatment. So to begin, I want to suggest that participants' accounts of interferon-based treatments evoke a sense of crisis. And I don't want to spend too long on these accounts as I've got a short amount of time, but also they're very well documented in the existing research. But briefly, people describe, to quote, horrid treatment experiences commonly liken interferon-based treatments to notoriously arduous cancer treatments, and some people describe feeling tricked by medicine. So side effects alone would be enough to support an argument that interferon constituted a crisis in healthcare in which the cure was worse than the disease. However, the crisis I'm referring to here is a crisis that is gathered through the limiting social and temporal conditions of interferon. And so in addition to these terrible side effects, interferon formed a common horizon for many participants of concern and fear for themselves, friends and the future, and muted expectations for healthcare. The crisis period was described by many as lost time, a time of sickness, waiting for future cure and enduring interferon, and for some for whom interferon was unsuccessful, wasted time. So while hepatitis C is a slow-acting disease, I argue that this period before the new DAA treatments can be productively understood as a form of crisis in which people with hepatitis C were cast out of time and out of the future, to quote Kafer. Oh my goodness. Every presenter's nightmare. So for the rest of this presentation, I want to explore how this sense of crisis shapes treatment in the period after the new DAAs, which following Kagan I'm referring to as post-crisis. So the first feature of treatment in post-crisis is the curative imaginary. And one way that this imaginary takes shape is in the accounts of optimism and future thinking that characterise discussions of and decision-making about the new treatments. So Terence, for example, says, "All my counsellor could sort of say was there's really exciting new treatments on the horizon and it's a lot different to interferon." Participants also explained that the new treatments and cure were often described by health professionals as straightforward, simple and easy. As Dave recalled, he was told, "Oh, Dave, it's great. You've just got to remember to take your meds. That's all you've got to do." And some people delayed treatment to wait for this future cure. Chris, for example, was informed that the Harvoni, which is a direct-acting antiviral hepatitis C treatment, The Harvoni cure was coming, so he postponed treatment. He says, no, I did nothing. I didn't want to do anything. And I was always saying to my doctor, Hep C doesn't worry me. It doesn't affect me. And that interferon is so awful. Why would you bother? And in the future, we will see what happens. And in the future, the 12-week Harvoni cure came up and I jumped at it. So following CAFA, I argue that the broader curative imaginary of the new treatment, forged through a politics based in futurity, often leads to an ethics of endless deferral. In these examples, the deferral of treatment is an obvious example of what gets put to the side or held back in service of the curative future. However, what else is deferred and altered in the present conditions of hepatitis C transmission and treatment and in the general concerns, desires and practices of people who acquire hepatitis C? So in what follows, I step out some of the implications of this imaginary for living with hepatitis C in the present. So in post-crisis, treatment, as we've seen, is commonly presented as uncomplicated and requiring little active engagement or decision-making by the patient beyond adhering to medical advice and taking daily medication. So an unintended consequence of what Kagan refers to as the disavowal of crisis discourse is that participants describe being given less information about hepatitis C and long-term health effects. For example, Lou, who found out as an adult that she had medically acquired hepatitis C as an infant, described the focus on the efficacy of the new medications and cure in the absence of other detailed information, confusing and paternalistic. She says, I remember thinking, that they are making assumptions that I probably don't need this information, but actually I do. I would have liked some of that information. My infectious diseases doctor was very kind and nice, but very sort of, don't worry about that and you'll be fine. I mean, he was a bit paternalistic. I remember freaking out because at that stage he was like, there are new drugs coming onto the market. They are very, very promising and they'll be available soon, but they're not here yet. New articulations of hepatitis C as easily curable may be helpful for some patients, but there's a risk that the focus on medical cure and transformative futurity may not foster informative and caring healthcare encounters or patient confidence and agency in the present. As Sia and Lenton note, treatment that is firmly focused on a future of elimination may ignore the needs and rights of people with hepatitis C in terms of these changes in testing and treatment and changes to consent. And importantly, the temporal relations of crisis and post-crisis I'm tracing in this presentation, I think essential to the invisibility of this complexity, working to conceal the present forms of support and institutional habits and practices that require ongoing attention. So as might now be evident, central to post-crisis representations of treatment is the assumption of progress, of temporal change and improvement. However, even though the new treatment may be less burdensome for patients, I argue that overly enthusiastic claims about progress or a new era should be approached cautiously. Notably, one striking continuity in accounts of hepatitis C treatment is how it remains one of the few opportunities for people who have hepatitis C to participate in and pursue citizenship. Colin, for example, like many participants, describes cure as empowering. He says, I was spick and span, you know what I mean? I was sparkling then, the mud was gone, Yeah, that's what it was. I remember walking taller and feeling different. It was like, okay, I've got a chance. I've got another chance now. It's like I've been given a second chance and I can really be a change agent now in a lot of different facets, It was so bloody liberating. So research suggests already that curing hepatitis C, I think Adrian mentioned this too, offers a break with the past stigmatising life and the emergence of a new legitimate subjectivity. But what I'm interested in is the significance of these accounts and including their orientations in and towards the future. I think these accounts provide insight not only into cure, but the ongoing significance of medicalisation and treatment for people who have hepatitis C, most of whom in Australia inject or have injected drugs and commonly face considerable social disadvantage and marginalisation. And it is this very continuity in the conditions of legitimacy, for example, medicalisation and treatment, through which people who have hepatitis C come to understand themselves and revise their identities, that I argue complicates any simple claims about progress or a new era. In this purportedly new treatment era, we can see the reverberations and binding effects of crisis, insofar as the rush to cure has overshadowed not only important considerations in care, but limitations and continuities in the conditions through which hepatitis C and its subjects emerge in highly stigmatised ways. So, In this presentation, I've traced some of the ways that the older interferon-based treatments continue to materialise contemporary treatment experiences beyond a focus on the reputation of side effects as an impediment to treatment. So using the concept of post-crisis and work on curative time, I've argued that the crisis of interferon-based treatment continues to shape and haunt the post-crisis treatment landscape through its enthusiastic yet narrow focus on cure and elimination. In this sense, the post-crisis or post-cure era of hepatitis C treatment is perhaps not understood as a distinct new period of progress and change, but a period of what Kagan refers to as re-scripting in our understandings of hepatitis C and treatment, which still bear and reproduce many of the same underlying assumptions. Significantly, medical curative treatment continues to be the central means through which hepatitis C is understood, and people with hepatitis C, especially those who inject drugs, are enrolled into normative futures. As it stands, the curative imaginary shaping the current treatment landscape continues to constitute life with hepatitis C as out of time and waiting for cure. So while the new DAA treatments have in some respects addressed this crisis in treatment, the resulting narrow focus on progress, cure and elimination futures and the continued politics of medicalisation have done little to address the ongoing conditions, I think, through which hepatitis C materialises. Thank you.
Thank you, Renae. And again, I was so absorbed that I forgot to indicate the 3-minute mark, but that was really well timed. And we have 3 minutes or a couple of minutes for questions. There were beautiful resonances across your work and Adrian's, and I now see that I should have held off on my question about temporalities.
I was going to jump in and like help Adrian out and be like, just say Renae's speaking about it, but I thought he might say that because he's seen this article, but nonetheless, so I thought the same.
But it's great resonances across your work and also Kate's, so that was terrific to see. While we're waiting for questions, I really liked your application of Dion Kagan's work, and it's great that Dion's here with us today. And I guess because this is partly because of my own background in HIV, I wondered if you could speak a bit more to the resonances and differences perhaps between experiences of HIV treatment and Hep C treatments, because you've drawn on this notion of post-crisis really compellingly, but I'm conscious that there might be some points of disconnect between experiences of HIV treatment and Hep C.
Yeah, I mean, I don't know if this specifically answers your question, but in the longer article, I do point out about how in hepatitis C, in HIV, the field of HIV and AIDS scholarship, the notion of crisis also refers to, you know, the stigma and discrimination in the treatment of gay men in that period as well. So I kind of do step that out a little bit and try to, you know, and try to make that I'm also speaking about treatment, but it's not just about, it's not about kind of stigma per se in the same way in the response to the kind of HIV and AIDS epidemic. But I do step that out in the article a little bit. But again, I wonder if Anthony might be speaking about some of that stuff after this. I can't say that I don't feel very well versed to speak too much about HIV, so hopefully that'll get stepped out in the next presentation.
Sure, I'm sure that's one of the great things about the resonance across the pieces in this panel. So yeah, Anthony might speak to that. Do we have any questions, any other questions for Renae? Renae, I'd love to, if you could share your paper if it's out, or when it is out. I'm sure other attendees would really love to read it. So yeah, it's a fascinating piece, really rich and beautifully nuanced analysis. So thank you so much.
Oh, thanks, Karen.